Good afternoon, everyone. Thank you for coming here and listening to me. I'm Dr. Ettefagh. Some of you guys already know me. I'm gonna talk about non-surgical treatment options for chronic back pain here today. As you guys know, and some of you guys are involved with back pain, a lot of people all over the world are involved with some sort of chronic back pain, neck pain, spine pain. It affects their financial life, physical life, family life, psychosocially can affect them, and it's very hard sometimes to manage. The most important thing is like 80% of the treatment. I always tell my patients that 80% of the treatment is on us. Us means like patients and also 20% maybe physicians. Then it's very important, you guys, to have enough knowledge how to do your daily activities, how to avoid doing the things that can aggravate your pain and can prevent further injuries. We talked a little bit about the effects of back pain. 245 million people per year are involved with some sort of back pain. It peaks between 40 and 50 years of old. Some patients, some people can have back pain when like as a younger age, but usually it increases after 40, 50 years old. And at that time, when I tell my patients to start doing exercises, they say, I've never done exercises and I've never had big back pain, but yes, it's the time that we need to start doing exercises. We need to be careful about our back because we are no longer 25 years old and we don't have our spine when we were 25-year-old. It's estimated that back pain is increasing among people as well. The common reasons for back pain is mostly like back strains, the muscle strength. Like tendon injuries, ligament injuries, like we lift something in a not proper way. We sit for a long period of time. We go long distance driving from a city to the other city, sitting in the car for 10 hours. And then after that, we notice that we have a lot of back pain. Usually the back pain with some conservative management should go away. There are other causes of back pain, like osteoarthritis, degenerative disc disease, that we will talk a little bit about them as well. Then what is very important, be careful about the posture. Poor posture, poor biomechanic, like the neck, the position of the neck, the position of the back, like big bellies, how you sit at the desk, how you sit on the chair, how you sit on the couch and watching TV. These are all very important. Like sport-related injuries. Sometimes we start doing sports, exercises, without knowing how to start exercises in a proper way, and we are not fitted and well enough, then we can hurt ourselves as well. Then these are all very important to pay attention to. When we have back pain, how to deal with? If we have a lumbar strain, just a simple back pain, we can start by applying heat, ice to the area, do some massages, take rest. Sometimes we can take like Tylenol, over-the-counter NSAIDs such as naproxen, ibuprofen. We can do some stretches, some exercises, gentle massages, change our mattress if it's not a good one, change our pillows if it's not a good one. Sometimes we can use muscle relaxants, which usually they are being prescribed by the physicians. Sometimes taking supplements to help with our stress, to relieve tension from the muscles. And there are other medications as well. A little bit about NSAIDs like Aleve, ibuprofen, Motrin. These are NSAIDs. We call them these are anti-inflammatory medications. About the side effects, they can affect your heart, they can affect the kidneys, they can affect your stomach. If you are taking anticoagulations or aspirin at the same time, you should be very careful because they can increase the risk of bleeding. If you have kidney failure, please avoid taking NSAIDs unless your doctor tells you to take. And usually we should be careful about taking any of these medications because the medications can help in one side and also they can have side effects on the other side. I want to talk a little bit about what an ideal posture is. If you look at the picture on the left side, you see that she's standing in a way that her neck, the upper back, the lower back, the spine is in line. Lower pictures, look at the left picture. The person is sitting in the chair with a slack back, looking down to the cell phone. How many of us every day is looking at our cell phone in this position and we just notice that, oh my God, I have been sitting in this position for half an hour. Yes, if you have back pain, if you have neck pain, your neck pain and back pain will never get better if you are not working on your posture. How you can work on the posture, look at the second picture on the right side. She's sitting more straight, neck, head, back, spine is in line, and she's bringing her hand up. The cell phone is in front of her face, then she doesn't need to bend her back, she doesn't need to bend the neck. Then this relieves a lot of pressure from the spine. There are some changes that we need to do for our nutrition, like being more physically fit. We talked a little bit about the good posture. We will talk how to lift objects, how to put them down, how to sit, how to wash things, how to drive. Overall, the most important thing is working on a healthy diet, weight management. If we are obese, if we have a big belly, the first thing we need to start working on our weight management. If we don't have any back pain and if we are not physically fit and if we are overweight, sooner or later we're gonna have back pain, back issues, we're gonna have problems. Then it's very important to take it into consideration. A little bit about nutritional changes. Enough calcium and vitamin D prevents osteoporosis. Osteoporosis, which is weakening of the bones, which is more prevalent in female people over 50 years of old, can put our spine or bones at risk for fractures and can end up with back pain. How we can take enough calcium, vitamin D, sometimes we need supplements. Sometimes we can take it from the food. What kind of food? Like dairy products, green leafy vegetables, like sometimes the milk or some other juices, they are fortified with calcium and vitamin D. Vitamin D you can find in like sun exposure. We don't get much sun exposure during winter time in Michigan, then we need to be careful. Sometimes we need supplements. And enough hydration. Please drink enough water. What is enough water? Like 1.5 liters and more, like up to 2 liters. If you have heart failure, talk to your cardiologist how much water you are allowed to take. If you don't have any heart failure or kidney failure, then a good amount of water for you will be around 2 liters per day. It helps with your brain function. It helps with the mood. It helps your discs. The discs, which are like a cushions between vertebral bodies, they can get hydrated And when you do activities, when you do exercises, you will have less injuries to your discs. Specifically, before starting doing exercises, please hydrate yourself, because if you do exercises when you are thirsty, when your body is dehydrated, you are at more risk for injuries. Physical fitness. What is the minimum amount of physical fitness? Based on the research studies, at least 30 minutes per day, at least walking in a moderate speed, at least 5 days per week is the minimum amount of exercise that everyone needs to do. Less than this amount, the person is not doing any exercises. Aerobic exercises such as walking, jogging, biking, swimming, they are included in this type of exercises. It's very important to help you with your balance, strengthen your muscles, make your muscles stronger, and helps with back pain and prevent further injuries. There are some exercises such as Tai Chi and yoga. There are a lot of research studies. There are a lot of articles that these two exercises are very good, specifically in elderly, helps with their balance, prevent falls, to make their muscles stronger, and for increasing the flexibility of their muscles. Working on the abdominal muscles is very important because something needs to support our back. What is that something? Is the muscles of the abdomen and muscles of the pelvic area, and also the muscles of the lower extremity, the legs. We need to work on our core muscles strengthening. And we talked about healthy weight, which is very important. What is lifestyle modification? Just very regular, like the things that we do every day, like when we wake up in the morning, how we brush our teeth, how we wash our hands, how we walk, how we sit, how we drive, how we sit at the desk, how we do exercises, what kind of shoes do we have, what we eat, what is our weight, how we wash the dishes, how we wash the clothes, how we make up our bed. And like we talked about driving, and then at night, how we sit on the couch, how we watch TV, how we go to the bed, what kind of a mattress do we have, what kind of a pillow do we have, how we sleep. Do I sleep on my face down? Do I put my arm under my head? What is the way that I sleep? Every single one of these are the ones that is giving you pain. And if every single one of these are the ones that we need to work on. Otherwise, we will always be in pain. We are getting a lot of medications. We are doing a lot of injections. We end up with surgeries. Still, we are dealing with pain. Then we need to be careful about every single activity of our daily life to do it in a more proper way. Okay, I want to take your attention to the picture like on the left side. On the third row, see the person is standing straight. This is a research study that they evaluated different postures and the pressure over the lower back disc area. They found out that if we are just only standing, not bending, nothing, there is about like 100 power, whatever, pressure on our lower back area. If we just, from here, if we just bend, look at the other one, if we just bend forward without any weight, the pressure goes up to 150. Just imagine when you're standing, when you just bend and you want to pick something from the floor, then the pressure over your back increases. And now look at this one, that the person is bending with the weight in his hand. See how high the pressure is. It's about 220. Just imagine if you have a lot of back pain, if you bend forward and to pick something from the floor, if that object has a little bit weight, just imagine how much weight your back is suffering. Let's get back to the picture that the person is sitting. Just by sitting on a chair, you have 140 power pressure on your back. Compare it to just the person that was standing. You see, when you're only standing, there are less pressure on your back than when you're sitting. Then if you're working with your computer all day, sitting at the desk, it's not a bad idea to have a modified table, to sometimes stand up, sometimes sit. Change of position is very, very important to have less pressure on your back. Then I have patients that they tell me that, okay, all day I'm sitting at the desk, I'm not doing anything, but I get a lot of back pain. Now look at the other picture, that this person is sitting on the chair, just a little bit bending forward. See, from 140, the pressure increases to 185. And the last picture, the person is bending with the weight in hand. It's 275. Then when you are sitting on a chair, bending forward, like to pick something from the floor, there are lots of pressure on your back. Then if you have these problems, if you have back problems, we need to help this area to get healed. With any sort of pressure to the back area, which is not proper, we don't let it heal. Look at the other pictures. The first picture on the left side, the person is driving. The person is sitting far from the wheel. And look at the second picture. The person is sitting more close to the wheel. Head resting over the headrest, neck, back, aligned, sitting closer to the wheel. This is a better position. If you look at the angle of the back seat and the seat, it's about 105 degrees. Then please, next time when you are driving, take a look at how you are driving and what is the distance between your seat and the wheel. If you're sitting in one place for 20-30 minutes, please stand up and walk a little bit and do stretches. If you are driving long distances between cities, at least every half an hour or an hour, stop by, take a break, do some stretches, and then continue. And pay attention to the position of your chair, to the position of the seat, and how close you are sitting to the wheel. The other, like how we are lifting objects from the floor. Lifting, twisting, they are like, can have like a lot of effect on our back. We just talked about how bending from a standing position can increases a lot of pressure on your back. Twisting is the same. I had a patient, young person, he told me, I bent in a twisted motion and I lifted a heavy object. And since then, I have a lot of back pain. Then it's very, very important. We need to be careful about the way that we do things. Avoid heavy lifting. And specifically when they are repetitive, it's repetitive injury to our back. When we want to lift something from the floor, stand with your feet shoulder width apart. Stay as close to the object as possible. Make sure that your neck, upper back, and lower back, they are in a line. Make sure as much as possible, don't bend forward. Please bend your knees. If you look at this picture on the right upper side, the person is standing with the feet shoulder apart almost maintaining the spine in line, bended the knees, lifted the object from the floor, or if you want to put the object on the floor, the same thing with maintaining your spine aligned with your knees bent, put the object on the floor and stand up with your back straight. The second picture shows the wrong way. How many of us, how many times a day we do the wrong way, bending down, picking something from the floor, heavy or not heavy, how many times a day we do it? Just imagine how bad it can impact our back pain or puts us at risk for further injuries. Overall, it's better to avoid lifting heavy objects. We can use some tools like dollies, or we can get help. If you need to carry objects, don't carry them all in one trip. Just step by step, like lighter weights. Like when you go to Costco, you do a lot of shopping. Don't put them all at once on your truck, or don't take them all together to your house. Just make small trips and lower weight objects to move. Be careful not to have falls. A lot of my patients, they tell me that last year I had a fall, since then I'm having a lot of back pain. Or my back pain was getting better till I had a fall. Be careful about the floors. And we talked a little bit about the mattresses. What kind of a mattress we need to have? Look at the pictures on the left side. It's a very hard mattress. It's not flexible. It doesn't get the shape of the spine. The second mattress is a very soft mattress. It's very soft. And the third one is a firm mattress. What we need is a firm mattress. Not very hard, not very soft. What is the good way to sleep at night? If you're laying on your back, you can put a pillow under your knees. Specifically, if you have back pain, if you put a pillow under your knees, this relieves pressure from your back. Specifically, if you have lordosis, which is the curvature, increased curvature on your lower back. If you lay on your side, you can put a pillow between your knees. Studies show that it's less pressure over your back. Avoid lying on your face down, and avoid putting your head up on under your head, because it's not good for your shoulder and it's not good for your neck. Do not use any products that have nicotine, tobaccos, cigarettes, e-cigarettes, and if you need any help to get rid of smoking, please ask your doctors. There are ways to get rid of these things. If you're smoking, you will continue having back pain, because smoking doesn't let your body get healed. Anxieties, if you're anxious, if you have depression, if you have anxieties, mood and your body, they are in very close relation with each other. It's very important to have a holistic approach to your pain. What is holistic approach? Pay attention to your brain function, pay attention to your mood, pay attention to your body, how fit your body is. They are all connected. If you have a lot of anxieties and depression, you will continue having pain. If you have a lot of back pain on the other side, you will continue having anxieties and depression. Then we need to work on all these. I can't only say I'm doing exercises, I'm doing physical therapy, but I'm continuing having pain. Maybe you haven't paid attention to the other parts that you had to be able to take care of them. Some more examples about daily activities. Look at the picture on the left side. The person is bending, washing dishes. The other picture, next to that, the person is careful about having inline spine and as close as possible to the sink. Below that, the person is sitting on the chair, bent posture. The second one, sitting upright. Be careful about the posture of the shoulder, the neck, the back, as close as possible to the desk. The middle picture, be careful about when you are looking at the computer needs to be almost in front of your face, sitting upright. The elbow, the angle of your elbow and the table should usually be around 90 degrees. The angle of your back and the angle of back seat and the seat needs to be around 100, 105. And always be careful to the knees be higher than your hip level. If you put something under your knees, at least one of them, it helps to relieve a lot of pressure from your back. The other picture is the person moving a bed. Like the person is trying to maintain the spine aligned. The second one, bent posture, which is not good. And we talked about how to pick up things, to lift weights. This is the first picture. The person is trying to maintain the upright position and with knee bends. And this person is the same picture as the other one. More pictures. If you want to pick something from the floor, don't bend down. Kneel down with one knee, front, pick it up, maintain the spine straight. The second picture, down, the person is laying on the back. We talked about putting the pillow under the knees helps to relieve pressure from the back. These two people, they are bending and washing the bathtub, which is not a good position. It's better just to sit and maintain the back straight. The other picture, the person is laying on the side with a pillow between two knees, which is good. We talked about how to carry things. Next one, the left side person is bending and making the bed. The other one kneeling down, making sure the spine is straight and making the bed, which is a better position. Specifically when we wake up in the morning and when we bend, then it's a lot of pressure from the morning to our back. And the last picture, the person, the left side, the person is as close as possible to the trunk to unload the objects. The second picture, the person is bending forward with far distance from the trunk. Why back exercises are very important? Because we talked about it, that the abdominal muscles, back muscles, pelvic muscles are good support for our spine. We need to work on them to make them strong. And also we need to pay attention to strengthen and stretch all these muscles and also the muscles of lower extremities. And a little bit, I will go over the exercises. I'm sure that when you go to your doctor, first, we want you guys to start with physical therapy. I've heard a lot from my patients that they say, I've done physical therapy, it's not working, it didn't work. Physical therapy, what is physical therapy? Starting supervised exercises and education about your daily activities. And they will give you some exercises that you need to do at home, at least twice daily. Every 5 weeks, if you are consistent with your schedule, you will be gradually better and better. How many of you guys were consistent and patient enough to do all these exercises at least twice at home and 2 to 3 times physical therapy? Also, a lot of time, I want my patients to continue another round of physical therapy. I want them to do a lot of, like, at least 3 months of supervised exercises as well as home-based exercises to see the effects. then please be patient and please be consistent with your exercises, which is very important. One of the most important exercises that a lot of time I tell my patients to do is water aerobic exercises. Start just by walking in the water and don't exert yourself. Just start with 10 minutes walking in the water and gradually increase it. Walking in the water helps with your mood, helps with your brain function, helps with your body. The water itself increases the circulation toward the area of pain, increases the flexibility, and also it's exercises. Even just walking in the water, it's better than walking outside. Specifically, if you are obese, if you have knee pain, if you have hip pain, definitely I will recommend you to start water aerobic exercises. How many times a week? At least, if you can't do it 3 times per week, at least do it 2 times per week. And I usually tell my patients, just keep it forever. That will be your best friend. Pelvic tilt exercise. These are the exercises that I usually like my patients to start doing at home. Just pick a couple exercises for yourself. Work with your physical therapist. Make sure you know everything about the exercises and just continue doing them at least twice daily. Look at the first picture. Lay on your back, like bend your knees. Feet are flat. And try to tighten your abdominal muscle and bring your tailbone toward the ceiling. And stay in this position, starting from 5 seconds, gradually increase to 10 seconds. Then tighten your muscle down, your tailbone up, stay in this position for 5 to 10 seconds, and then relax. Make sure you're not holding your breath. Keep your breath going in and out. Otherwise, if you have high blood pressure, your blood pressure will go up. If you have any respiratory failure or heart failure, it's not good for you to hold your breath. Then do this exercise and keep your breath moving. Then like 5 to 10 seconds rest, 5 to 10 seconds, strengthen your muscle. Repeat this exercise multiple times, starting from 5, increase it gradually to 10. Then I would like you guys to do this exercise twice daily, and each time 10 times. 10 times strengthen the muscle and 10 times relaxation in between. The other exercise, please lie on your back, one knee bent, and bring the other knee close to your chest. You can also hold your knee from below the knee. It's helping for a lot of patients that they have knee pain. It's better just to hold it from behind the knee. Pull your knee toward your chest. Keep it like for 10 seconds. Make sure you are focusing on your breathing. Don't hold your breath. Then put this leg down and the other leg, same thing. Hold it from below the knee, pull it toward your chest, hold it for 10 seconds and release. Repeat this, each leg 10 times, twice a day. This is a good stretch for your gluteal muscles, the buttock muscles, the lower leg muscles. Cat-cow exercise. See the picture on your left side, the person with the arms below the shoulder, the knees below the hip, and try to stretch your back this way. Make sure you're not bending your neck a lot or bending it backward a lot. It's a curvature on your back and a stretch. Here you see that the middle picture, the person is doing a stretch on the back. The other side is curving the back. Next exercise is bridging exercise. You're laying on your back with your knee bent and try to lift your hip up. Keep it up for 10 seconds. Make sure you are not holding your breath. 10 seconds up, 10 seconds down. 10 seconds up, 10 seconds down. Repeat it 10 times and twice a day at least. There is another modified exercise for this one. When you are good and at the first exercise, then you can start doing the same exercise with your leg extended. It's making it a little bit harder. Belly crunches. Lay on your back with your bent, with your knee bent, with your knees bent, your feet on the floor. You can bend your elbows this way and just raise your head and neck up. Make sure you're not bending your neck down too much or putting it back. Try to maintain the alignment of your spine. This is a good exercise for having contractions, and it makes your abdominal muscles strong. Stay in this position for 5 to 10 seconds, and then relax on your back for 5 to 10 seconds, and repeat this up and down 10 times, at least twice a day. Again, make sure you are not holding your breath when you are raising your head and chest up, because it can increase your blood pressure, put you at risk. The other exercise, back lift. Laying on your face down, you can put a pillow under the belly, just with maintaining your spine aligned, neck back. Just bring your shoulders, head up, stay in that position for 5 to 10 seconds and down. 5 to 10 seconds up, raise it up, and 5 to 10 seconds down and relax. You can repeat this 10 times and at least twice daily. Any of these exercises, if you are not doing it in a proper way, may increase your pain. Then start like slowly and gradually increase it. And if there is a specific exercise that you do it and you get a lot of pain, then don't do that specific exercise. But overall, as a general rule, when we start doing exercises, at first, our pain may get worse, like about a week or so, and gradually it should get better. But still, if your pain is getting worse so bad, you can talk to your provider or talk to your physical therapist. One of the good reasons that we prescribe physical therapy for our patients is you can communicate with them, tell them that, okay, I have been doing this exercise, my pain got worse. What is the reason? They evaluate you. Maybe you're not doing it in the right way, in a correct way. They can correct you, or they can modify your exercise, and then you can continue that. Another exercise, press up. A lot of time, this exercise is not good for people, for the patients who have back osteoarthritis. Then I will just skip this one. There are some stretches, stretching exercises. The first picture on the left side, this person is doing stretches on the hamstrings, on the gluteal muscles, on the calf muscles. The other person is laying face down, stretching of the quadriceps muscles, the muscles that are in front of the thigh and in front of the pelvic area. This person is sitting, again, stretching of the hamstring muscles and the calf muscles. This person is standing up. Probably if you have a good balance, you can do this exercise. Otherwise, always hold on to something to prevent falls. Stretches are very important, opens up the fibers, increases the circulation to the area, and helps with your biomechanic, helps with the pain. We talked a little bit about the effects of back pain. We talked a little bit when we have back pain, what we need to do. We talked about our daily activities, that how we can help to do every single thing in our life in a better way, in a more correct way, that we can have and we can end up with less pain and prevent further injuries. We talked about NSAID side effects, and we talked about the physical therapy importance and home-based exercises. We talked how we need to work on our muscles to make them stronger. We need to work on our weight. We need to work on our diet, and we need to stretch our muscles. But sometimes they don't get healed. Sometimes our back pain continues, and it's important to see a specialist, a back specialist, to see what's going on. Specifically, if you have radiation to one leg or the other leg, if you walk for 1 or 2 blocks and start having leg pain, you need to sit to get better and then continue. If you're experiencing numbness, tingling, weakness of your legs or your arms, if you have issues, recent issues with the controlling of your bowel or your bladder, it means that you don't feel it, that you need to go and you can't hold it, and it's new completely to you. It's not related to prostate problems or like this kind of stuff or urgency. It's something that recently is happening to you, and all of a sudden you have accidents. You don't know, oh my God, I have accidents. I couldn't control the urine. These are some things that they are very serious, and you need to be evaluated. If you have unintentional weight loss, fever, chills, loss of appetite, please come and see one of the back specialists to be evaluated and make sure everything is fine and you get enough information. You know what to do for conservative management. If we do enough and appropriate conservative management, if the pain continues, we can have more invasive procedures. Maybe you need injections. Maybe you need ablations, like some interventions. And if the interventions are not helping and you have done everything for your back pain appropriately, I should emphasize that a lot of our patients haven't done appropriate conservative management in every way, every single way, paying attention to the weight, nutrition, mind and brain and depression and anxiety, good physical therapy, good daily exercises. If the patients have done enough conservative management, maybe we need to step forward and see a surgical consultation. Maybe the person needs surgery. I think this was a summary of how to manage our back pain, and I will be happy to answer your questions if you have any questions, and I will finish my presentation at this time. Yeah, strain is usually more robust, like more severe than a sprain. Sometimes when we lift a heavy weight in a not proper way, and sometimes our muscle get injured, some inflammation. Sometimes we have some tear inside the muscle fibers and the ligaments and tendons, like microscopic tear. But overall, the treatment will be the same, what we spoke about so far. How can they prove that they have chronic back pain? Usually, if your back pain continues more than 3 months, we call it back pain, chronic back pain. Usually with conservative management, good conservative management, the back pain should be subsided when it's acute. It's very much important to take care of your back when it's acute. We don't want to treat chronic pain. That's why very important to take care of the pain when it's acute or subacute, because as much as it continues, it will be harder to manage, because with your back pain, you're not able to do your daily activities, you're not able to do your exercises, your muscles get weaker and weaker, then everything at the same time can affect each other. Okay. It depends if it's an acute pain related to disc issues. If you're young, everything that we spoke so far, working on your daily activities, working on the muscles, working on the posture, working on the weight, everything helps you to prevent further injuries and helps the disc to get healed, like stop smoking, hydration, and some exercises. There are some exercises, the physical therapies can work with you, McKenzie exercises. But if like in a 75-year-old person with chronic back pain, degenerative disc disease, can completely disc shrink in, I cannot promise, but definitely I've seen a lot of my patients that the MRI shows disc issues, but their symptoms get better when they start working on all these. Yeah, if you have a lot of spasms, if you are experiencing the leg pain referring down your leg, I will recommend to see your back specialist. There are medications better, like there are other ways, like other than just taking NSAIDs. Maybe you need further evaluation. Maybe you need muscle relaxants, and they need to evaluate the reason why you're having these spasms. And gradually we'll start with everything that we just spoke about and working out together to get it healed better. I can't say out of exercises. Usually I tell my patients, this is a basket of the treatment I'm offering you. If I'm like offering you 5 different things like weight management, work on the diet, exercises, physical therapy, you need to see psychologists and also the medication. If each one of these ones are missing, we don't have a good cycle of the treatment. There is something missing. And it's very important to have a holistic approach toward our pain. Usually, we don't like back pain when they start at night. If you don't have any pain during the day, it starts in the middle of the night, and when you walk, it gets better. I would like you to see your back specialist. But sometimes, please pay attention to your mattress. Please pay attention to the way that you're sleeping. And a lot of time, disc issues can give the same pain. When you are laying on the back, looks like, and sometimes when the patients have increased lordosis over their back, when they lay on their back, they may experience a lot of pain. I will recommend put a pillow under your knees if you're laying on your back or between both knees, and see how it goes. And also before going to bed, you can take your muscle relaxant and also see if your mattress is a good one. It's not too soft, it's not too hard, and it's a good one. It's good. It's an adjunct therapy with everything else that we spoke about. You can't only say TENS can help you without exercises. I would say everything at the same time. How it works, the TENS is electrical stimulation to your superficial nerve and helps to block the pain transmission. It's helpful. At the same time, please consider everything else that we spoke about today.